Here's one more video about type 1 diabetes as a review. There are three types though, type 1, type 2, and gestational. In type 1 diabetes, the pancreas is no longer releasing insulin from the beta cells, probably due to the fact that there is just no insulin to help do this. They've wondered if this might be due to diet, perhaps something with wheats and grains, maybe something with even dairy products, milk. They've also wondered if this could be due to an introduction of a bacteria that has a similar antigen to the antigen that's already found on the beta cell. When these antigens are introduced, then an antibody will be produced by the immune system, and that antibody doesn't know which one to attack, ends up attacking both, killing the beta cells, and no more insulin is released. Maybe this could also be due to vitamin D and viruses, but they're not 100% sure. So what effect is this going to have? It's usually around 10% of diabetes cases that will be type 1, and it starts before the age of 14. And what happens is in cells, they're not getting in the glucose that they need because of the lack of insulin. Insulin allows cells to take up glucose. So when there is no insulin, no glucose is being brought in, the cells tell the brain, we need more, and that's going to cause release of cortisol, glucagon, and epinephrine. Begging for more, the liver will do whatever it can to increase the levels of glucose. So it starts taking from lipids and proteins all throughout the body to try and produce this glucose for the cell. What happens is, as lipids and proteins are being made, there's a byproduct, if improperly done, that are going to be ketones. The ketones will then cause one of the main effects of type 1 diabetes, of a low blood pH, or ketoacidosis. We would also expect, because of all this drawing of lipids and proteins, that we would start to lose weight. And there's both acute and chronic symptoms of this. Acute, you have polyuria, excess urine, polydipsia, excess thirst, polyphagia, excess desire to eat, blurred vision due to edema in the eyes, fatigue, ketoacidosis due to ketones, and hypoglycemia as we try and treat the patients with too much insulin. Chronic is going to be diseases such as microvascular disease, macrovascular disease, platelet abnormalities, and easily coagulating blood. Type 1 diabetes is then caused because blood glucose is thought to be low, releasing glucagon causes an increase in glucose, causes fatty acid partial oxidation, which leads to ketoacidosis.